Hi guys, this is another video lecture here for you. Today we're going to be talking about the mechanisms of disease, and I was going to break it up into a couple different videos, but I thought that you guys have the ability to pause and take breaks as you need to, and then work on the group discussions or assignments that go along with this. If you have any questions, feel free to message me and we'll get started here. All right. So there are different causes of diseases. As you all, I'm sure, know, heredity there are different diseases that are hereditary. Huntington's is one of those, and there are many. Diabetes is another one that can be hereditary, not always, but can be. Trauma can cause some diseases, inflammation and infection. Neoplasms or cancer, hyperplasias are just rapidly dividing, similar to cancers. Nutritional imbalances and impaired immunity can be the causes of some diseases. HIV is an immunity type of disease. We're going to go into each of those a little bit. Hereditary diseases are made up of errors in individuals' genetic or chromosomal makeup, and they can be congenital, which is present at birth, or and there's different classifications of these, such as single gene abnormality, several gene abnormality, or an abnormality of a chromosome. We think of Down syndrome in this classification here. There's also like a trisomy 13, I believe, that I've seen. Trauma is just physical injury or an external force, and there are different types of traumatic diseases. They are going to vary with your age, your race, your residence. They classify them in order of prevalence: motor vehicle accidents, poison, firearms, falls, suicide, suffocation, and homicide. So we look at trauma, and this isn't going with so much physical trauma as it is, well, I guess it is. So this particular picture is talking about just trauma, and that could be physical trauma, that could be emotional trauma. If you think about a child who watches their parent, a mother or a father for that matter, get abused by another person. I know particularly of some children who watched a parent be abused by somebody who was selling them drugs. And those particular kids who have experienced that trauma are 4 times more likely to become an alcoholic, or 15 times more likely to commit suicide. These are staggering numbers when you think about it. They are 3 times more likely to have serious job problems, 3 times more likely to experience depression. So these people who have experienced trauma, whether it be physical or emotional, are going to have some things going on. Now, that's not to say that they will have problems like this, but they're more likely to, is what this is saying. There are different types of trauma. They're in the mental health world, and I think in the primary care world too. They talk about big T trauma and small t trauma. When I was going through nursing school, I heard this and it was talked about. I can't remember in which program, but big T would be major events. These are normally seen as traumatic: a car accident, a family member dies in front of you, those types of things. Natural tornado. I think of the Joplin tornado when I think of this. My sister lost her home in the Joplin tornado, and my niece wasn't there to witness it, but we were there during the aftermath, and she had some trauma from that. Robbery, rape, urban violence, major surgeries, war. All of these things can, not will, can cause PTSD in some people. Small t trauma is something we think of that's overwhelming, but other people may not see it as traumatic. So these are unprocessed traumas. These are things like neglected children. They're not being abused, but they're just neglected. These these can turn into a big T trauma. And sometimes they're referred to as complex trauma, but other people may not see it as that. And if you have any other examples that you can think of with this, you can post it on our questions discussion board, but for this unit. But I can't think of any off the top of my head right now. But these are things that maybe I wouldn't see as a trauma, but they were traumatic to that person. Sometimes for some, a death in the family isn't traumatic for one, but it is for another. I think of when my grandfather died, and it really wasn't traumatic for me, but boy, it was traumatic for one of my cousins. And so I'm not sure what the difference was, but it was definitely a trauma for one and not for another one. So here, trauma is defined as any event beyond a person's ability to master at the time. And a person may withstand a big T trauma like a tornado or a car accident, but is weakened by it. So any kind of little trauma kind of pushes them over the edge and they're not able to cope. Let's talk a little bit about inflammation and infection. Inflammation is just our immune response. It's triggered by an injury or an irritant. This happens with so many things. A broken bone would be a bigger one that inflammation is geared up for. If you think about if you twist your ankle or you sprain your arm, it swells. And that's what this is. If your body is just trying to protect whatever area is injured, so it swells the tissue around it to try to protect that area. But it can become infected, and that's the invasion of microorganisms into that tissue that causing the cell or tissue injury. And so when an infection gets in there, it's going to be inflamed also, but usually the inflammation comes first. So here is a picture, just a graphic for you guys on the causes of inflammation: obesity, diabetes, asthma, allergies. A lot of people don't think of asthma as an inflammatory disease because they don't know a lot about it, but it for sure is an inflammatory process. It's an inflammation of the lungs, and those lungs become filled with mucus, and it's hard for people to breathe. Infection and injury can cause inflammation. Cancers can cause inflammation, eye disorders, cardiovascular disease, gingivitis. And there's a good picture of some inflammation, probably some infection also. I honestly don't, this is just a picture I found online, but it just shows you like the difference between one foot and the other. Okay, so let's talk a little bit about hyperplasias and neoplasms. And hyperplasias are just an overgrowth in response to some sort of stimulus. Neoplasms are also known as tumors, and oncology is the study of cancer. We will get into this a lot later in another chapter, and so I'm not going to cover it too in depth. There are different classifications of neoplasms. There's benign, which are low, they're not growing. They might grow a little bit, but they're not going to grow a lot. Encapsulated, these are enclosed in the capsule. My youngest sibling had a neoblastoma, which was a tumor in the abdominal area, and it was an encapsulated tumor, and so they're able to go in and get all of it in one setting. Malignant just means uncontrolled growth. It's just growing rapidly, and they can't control it. Rapidly dividing cells. And cancer would be a malignant tumor. Metastasis just means that it moves and spreads. And when you think about this, try to think about, like, usually how they can tell this from what I've been told is that, let's say they say that they have breast cancer that has metastasized to the liver. And I used to wonder, how do they know that it started in the breast, or how do they know that it started in the kidneys or brain? And it's because that when they go to do a biopsy of the different cells, it'll have pieces of that first, it'll have components, I guess would be the better word, of that first initiation where it was started. So it may be in the liver, but they can see that it developed in the breast or wherever it started. Metastatic means it moved from the site of origin to a secondary site in the body. And there are some cancers that are more likely to move than others. Nutritional imbalance, this is usually related to an over or an under consumption. This term here that I don't even like to pronounce is usually associated with HIV patients, and it's just an ill, thin, wasted appearance. They're very skinny, very, they have like a failure to thrive appearance almost. Obesity, we look at a lot at BMI, which is body mass index. That's calculated by your height versus your weight. And there are alternatives to both of these things where they can give you food by injection, or nutrients, I guess I should say, by injection, or you can get nutrition through your small intestine. You actually can get, it's a form of food through IV that helps people, but most of the time, I would say, in the world that we live in, that they're going to get it through their nose, generally into their stomach. 1 in 5 patients, it says, will die from this, not from their cancer. So they're, wasting away. So this can be, I said HIV, it can also be associated with cancer. It's a really sad process to see somebody waste away from cancer. I don't know if any of you have had to deal with that. I haven't so much, thankfully, in my family. My grandmother passed away from cancer, but she passed away very quickly once she was diagnosed. So this can be very tough. You see a lot of this in long-term care facilities where people will go in at their end stages of life and they may live for months and not be able to eat. Impaired immunity, our body's first line of defense is our skin and our mucous membranes, tears, secretions, but our skin is our very first line of defense. And when something breaks through that skin, that's when our body starts to kick in and try to fight that off. But sometimes if we have impaired immunity, our body isn't able to do that. There are some protective qualities of the immune system, like leukocytes, that are white blood cells that go and kill those foreign invaders, like bacteria, things that get into our body past our skin. And our body's going to react to those antigens by producing antibodies. If you guys want to look at that further, you can. It's very interesting to look at how the immune system works and how those white blood cells actually go in, and there's a process called phagocytosis where they go in and actually eat all of the foreign invaders, the things that are bad for us, and then they essentially die and in that area, and that's what produces kind of that pus response that we get when we have something like a splinter or an ingrown nail, something like that. Antigens are substances that cause the body harm and set off a specific response. And antibodies are proteins that render the agent harmless. So when you think about this, antibodies, antigens, I always think about similar to immunizations and how that works. An antigen is any substance that's capable of exciting the immune response, the immune system, and provoking an immune response. So some examples of some common antigens would be foreign proteins, large carbohydrates, pollen, microorganisms. Now keep in mind that you don't have to have any of this memorized per se. I'm just giving you a good foundation. What you need to know for the exam, I will let you know that. But I really want you guys to have a good knowledge of this so that when you are going about in your day-to-day, you'll have a basic understanding of how the body works. The main purpose with that is so that you guys aren't spreading false information to clients and that you know basic knowledge. So some of these things you're not going to need to know, like nucleic acids. But when you think about an antigen, just think about it's not a part of the body. All right, so still on impaired immunity, there are some common ways that the immune system fails. So we think about allergies. Our immune system, when we have an allergy, our immune system is not able to keep up with that. Rheumatoid arthritis, so autoimmune deficiencies or autoimmune disorders, that sometimes is the body that's not able to keep up, or sometimes the body attacks itself, and so the immune system just isn't what it should be. And then HIV, of course, immunodeficiency. Now, there are treatments nowadays for HIV, which is amazing. 20 years ago, I would have never thought that there would be, I guess I did think that someday there would be. I didn't know if it would be within my lifetime, a cure for HIV. But I don't know so much a cure as there is a treatment where they say that people aren't contagious anymore. Aging, so it's just a degeneration as we age. There are different diseases related to age. We get tissue degeneration, changes our functional activity to lower or lesser levels, and it's the body's ability to repair and replace itself slows down with the aging process. Cellular injury, there are different causes of cellular injury. So hypoxia is just not enough oxygen, and anoxia is no oxygen. Now, you don't need to necessarily have that memorized. But what I do want you to know is within your client population, there are going to be episodes where times where you're going to see hypoxia. And I don't know how many of you guys smoke, but when someone is smoking, they're not always getting enough oxygen to their body. And so there are different evidence of that. I don't know if I have a picture in here, I can't remember, but there's clubbing of their fingernails. You can look that up if I don't have a picture in here, but it's very interesting that you can see the effects of long-term hypoxia on the body. Now, anoxia would, obviously you're not going to survive with no oxygen, but people do survive with not enough. Over long term, it's not good. There's drug or bacterial toxins, and there's viruses that can cause cellular injury. All right, there's different types of cellular adaptation. Atrophy is a decrease in the cell size. Hypertrophy is an increase in the cell size, and hyperplasia is an increase in the cell number. I think I do have a picture in here of this. Dysplasia is an alteration in size, shape, and the organization of the cell. Metaplasia is the cell changes to another type. You don't really need to know that. And then neoplasia is just the development of the new type of cell with uncontrolled growth. So of all of this that I've said, really neoplasia, really need to know that when it talks about uncontrolled growth, that's not good. And here's just a picture of a normal cell and then a cell that's atrophied. These could be muscle cells. When you think about, like, I don't know if you have ever had a cast, and then when they go and they take off the cast, one leg will be smaller, the broken leg will be smaller than the right leg because the muscle has atrophied because you're not using it, or an arm anywhere in there is going to be smaller because the muscles haven't been used. And then hypertrophy of a cell is just going to be bigger. Hyperplasia. Dysplasia, that's where they are growing wonky. Metaplasia. And then this is a neoplasia of the cell. It's just rapid growth. All right, so cell and tissue death. Necrosis is just cellular death. I do think I have a picture in here at some point of necrosis, but that's when you get that black, your skin's going to look black. There's something that's dying. Ischemia is decreased blood flow. With this, if you don't restore blood flow, there is going to be it's going to eventually be necrotic tissue. An infarct is just an area of dead cells. When you hear about this, a lot of times you'll hear about it in the heart or the brain, and that's an area where cells have died, first usually from a clot that has blocked that. And so that everything past that is going to infarct or die. And then gangrene is just a bacteria involved in the necrotic tissue where it gets this gangrene appearance. There's gangrene for you in necrotic tissue also. Gangrene, there's different kinds. You don't really need to know that, but it's going to be black and it's going to smell bad. I've only seen in my lifetime as a nurse, I've only seen gangrene once, and it wasn't pretty. All right, organism death. There's mortality, morbidity, and then this also talks about the criteria for brain death. And they usually will, well, they always will do an EEG to confirm brain death, but mortality is just death, and morbidity is the state of being diseased. What is the morbidity of that disease? How long does it last? All right, that is the end of chapter 2. If you guys have any questions, feel free to let me know, and be sure to keep up with your discussions and your assignments, and then I'll see you. I don't know when you'll watch this video. I don't care if you watch them all consecutively or how you do that, but just be sure that you are keeping up, and then we'll do a test review also. All right, thank you.